Hi there, I'm Brad. I'm from Men's Health Down Under and Coolum Court Pharmacy, which is part of the Life Pharmacy Group here in Canberra. Today, as part of Men's Health Week, which runs from the 15th to the 21st of June, I thought we'd put together a couple of little videos on men's health topics that might be of interest to our patients. Today I wanted to talk about prostate cancer. Prostate cancer affects about 20,000 men in Australia annually, of which 10,000, roughly half of those patients, end up having what's called a prostatectomy. A prostatectomy is when the prostate is removed because it's cancerous, and typically the patient recovers quite well from this and can often be left cancer-free, which is wonderful. So survivorship for prostate cancer patients has really improved. Certainly medications, radiation, chemotherapy, those sorts of treatments have also changed a lot over recent years, and we are seeing men that are far better managed with prostate cancer these days now than ever. The reason I think this is important is because it's comforting to know that even with a diagnosis of prostate cancer, life can be relatively normal. The quality can be relatively good. But it is important that we seek help early, because with early detection, we can make good informed decisions, and we see patients that are much more comfortable and living more fulfilling lives beyond prostate cancer. Symptoms of prostate cancer can be fairly nondescript, and sometimes patients will have no particular symptoms. The best way to find out if you've got prostate cancer or to get a screening is to get a PSA check done. This is normally done from age 50 for those without a family history. If you've got a family history, your GP might suggest you get checked earlier, even from age 40. And this is a good idea because we do believe that there's some link between generations where prostate cancer has been prevalent. So if your father had it, you're at an increased risk of having prostate cancer too. So the blood check tends to be the most common check. Sometimes the doctor might do a digital rectal exam, in which case they feel the prostate. But typically now we're seeing patients are given a PSA blood check, and that's a good starting place. I did mention symptoms before being fairly nondescript. Sort of symptoms that you might experience if you've got some enlargement of your prostate could include getting up at night to go to the toilet on multiple occasions, a weak stream of urine, so not as strong as it used to be, and it can be a bit start-stop in that it can be hard to start the flow of urine, but equally it can be hard to stop the flow of urine. Typically men report when they've finished voiding that then it can trickle or dribble a little bit. This can be a bit of an indication of enlarged prostate. Some men find it can affect their erectile function, but it can be fairly nondescript. And I think it's really important to note that an enlarged prostate and prostate cancer do not go hand in hand. They're not one and the same. And most men, by the time they're 50, about 50% of them, will have some inflammation of their prostate that can cause those sort of symptoms that I just mentioned. And as we continue to age, the prostate can continue to become enlarged, and those symptoms are fairly benign and not indicative of cancer. But that's why it's really important to take those symptoms, if you're getting them, as a prompt to go in and see the doctor to make sure everything's in order. Because like I said, sometimes prostate cancer can have no symptoms, and we want to get onto it nice and early before it becomes an issue. Stay tuned, we'll have some more videos on other men's health issues, and certainly if you've got any questions or queries, don't hesitate to get in touch with us at Men's Health Down Under or your local pharmacy, and of course your general practitioner who's in a really good position to help as well. Thank you.